and welcome to this week's episode of Let's Talk About. Let's Talk About is a midweek talk show put together by the Trinity United Church Legon, where we discuss topical issues that confront us in our everyday lives as individuals and Christians. For today's edition, we are discussing cancer, placing a particular spotlight on prostate cancer. We are reminded that you can watch us on our Facebook platforms, on our YouTube channel, Trinity United Church Legon. Follow us, subscribe, click on the bell icon so that you can be notified every time we are live. You can also send your questions, your comments, suggestions, whatever you might have to our WhatsApp number 0501 0501, I beg your pardon, 579996. 0501 5799996. In the studio with me today are two doctors, very brilliant doctors. To my immediate left, we have Dr. Jerry Emisa, a senior medical practitioner with the Trust Hospital. Welcome, doctor. And we have Dr. Enoch Taki, a urology fellowship in training from the Kolebu Teaching Hospital. They are going to help in our discussion today. You are reminded to watch us on Facebook and YouTube and send questions and comments to our WhatsApp number. Thank you for joining us. We're happy to have you. So we'll go right into the discussion. We are talking about prostate cancer today. We'll start off with a very basic question. What is the prostate gland, Dr. Emisa? What would you say the prostate gland is?
So the prostate gland is a gland in the body. Glands in the body are basically made up of tissues, and the prostate gland is made up of tissues that is located just below the urinary bladder. The urinary bladder is where urine collects. So urine is actually produced in the body by the kidneys, and then after it's produced, it trickles down all the way to the urinary bladder, where it is stored temporarily until the body feels an urge to pass the urine, and then you can void it out. So the prostate gland is this group of tissues that come together to form that beautiful gland that sits just below the urinary bladder. And then it also has a very important relation with a tube that in males leads further from the bladder and goes through the penis that we call the urethra. Yeah. So basically, that is what it is, and what makes it unique or more relevant even in males is the fact that it produces a certain fluid that mixes up with sperm during ejaculation, and then so that the product comes out as semen, which we know is used in reproduction.
Okay, thank you. I see Dr. Taki nodding. He's in agreement.
Yeah,
Okay, okay, great. Can you tell us some things that cause prostate cancer?
So, generally cancer, we do not know the cause. The causes are generally unknown. But, however, just like any other cancer, there are risk factors that would push us to suggest that a patient has prostate cancer. So for prostate cancer, we have typically you have to be a man, because obviously it's only men that have prostates. So men who are older, particularly from age 65 and above. But interestingly, currently we have young men even at age 40 having prostate cancer. So age is a risk factor. And then certainly the black race, for us who are Africans or people of African descent, we are at risk of having prostate cancer. And more so, we tend to have the aggressive form of the disease.
Okay.
And then family history. If you come from a strong family history, maybe your father had prostate cancer or has prostate cancer, you are at a very high risk of also having prostate cancer. Not just prostate cancer, but even if your mother had breast cancer or anybody in the family had colon-related cancer, you stand a high chance of having prostate cancer. And people have also said obesity. Obesity causes a lot of things. I would mention that at the latter end simply because it's not the number one high risk. So we put age, family history, and even people who have had prostate disease before, prostatitis and all that, you tend to have the risk of having prostate cancer. So these are just some few ones that are
Thank you. We'll come to more stuff like you've mentioned. Dr. Emisa, how does prostate cancer present itself differently from the other cancers we know and do not know?
Okay. So basically, every cancer will present in two different ways. When I say that, what I mean is you can have presentation that is related to the presence of the cancer exclusively in the organ of origin. So in this case, the cancer showing up in the prostate. And then you can also have a presentation that comes about from the cancer cells or that have originally come from the prostate spreading to other parts of the body.
Okay.
So you can have a myriad of symptoms that may come about because there is cancer in the prostate, and then you can have symptoms that have come about because of the spread, or what we call metastasis. Okay. So for instance, the symptoms that usually come as a result of the cancer being in the prostate, most of them have to do with the fact that the cancer may lead to some pressure effect on the tube that runs through the prostate gland that we talked about. I mentioned the urethra, which is the tube that empties, the urinary bladder through the penis and then outside. So if it happens that the prostate cancer is growing in an area of the prostate that is close to where this tube passes, then what happens is that it narrows the lumen or the caliber of the tube that is available for the passage of urine, and this may lead to some obstructive urinary symptoms. Typically, you can have difficulty initiating urine. You can have break. Once the urine is initiated, you will notice that the power in the urinary flow is much reduced, and sometimes you may notice that there is dribbling of prolonged drops of urine after passing urine. But I must mention that all of these symptoms I've mentioned are not necessarily exclusive to prostate cancer. For instance, you can have a benign or a non-cancerous enlargement of the prostate and still have all of these symptoms. Right. So I think that even puts it into perspective why it's important that we have this education, because the symptoms are important, but you can't just follow the symptoms alone to say confidently that you have prostate cancer.
Right.
And I must also mention that it is important to note that even in the early stages of the cancer, you may have no symptoms at all.
Interesting.
Yeah, and then you may also have blood showing up in your urine as one of the local symptoms that could come up. The other symptoms you may have depends on the extent of the spread, and so depending on which other organs in the pelvic area the cancerous cells may spread to, or sometimes even distant organs, then you may have symptoms correspondingly according to where the spread has gone to.
Okay. Yeah. Thank you for the in-depth knowledge. Doctor,
maybe
you
just to add to that, to clarify, most of the time the prostate cancer, the symptoms are asymptomatic. Okay. When we say asymptomatic, like he rightly said, you don't show symptoms, and that brings forth the essence of screening, and that's what the awareness or the message is all centered on. Okay. Because usually the prostate cancer has affinity for the edge or the peripheral zone of the prostate gland. It's like a chestnut. So just at the peripheral zone, that's where the lesions are. Okay. And he mentioned the tube, which we call the urethra, is centrally located. So for someone to elicit the symptoms he mentioned, it means that the disease must be advanced to have moved from the peripheral to the central zone. And so you have the symptoms that he rightly said. But there is this important symptom that sometimes, if you're a man and you see blood, and if I say man, a man who is elderly, and sees blood in the semen, you really need to rush to the hospital because we need to run some investigation. That could be a prostate cancer.
Okay.
And more importantly, renal impairment, and sometimes you are paralyzed. So if you see an elderly man who comes and is unable to walk, you need to examine the prostate.
Okay.
He may be having, when we say metastatic, the disease had spread to
Okay.
the spine and they can't walk.
Okay. So this screening you mentioned, how often should we do it?
No, for screening, we say every year. Now, the most important thing is at what age do we screen?
Okay.
Should everyone screen? No. Like I mentioned, the disease is really aggressive in African descent. And so we tend to advocate that for patients who are 40 years, male who are 40 years above, we need to start screening. More importantly, if you have the strong family history, as I mentioned earlier, from age 40, you can start the screening process every year, annually.
Every year, that's okay. Thank you. Dr. Emisa, are there different types of prostate cancer?
Yes,
Okay.
surely there are. So that is what we call the grade of the cancer. There are different histological types. So that is when the cancerous tissues are studied by the pathologist. There are different types that exhibit different characteristics. That's important to note because generally most prostate cancers tend to be slow growing. So again, that is another reason why we're emphasizing on the screening, because you may not pick it up if you are just waiting for symptoms. And then there's also there also exists, a very aggressive type, which unfortunately tends to be commoner in our race. So yeah, there are different types, and it has it has implications on the approach to the management as well.
Okay. Dr. Taki, would you add anything?
Okay, so for the type, like you said, histological. I mean, in the medical field, we have those who are adenocarcinomas, and those are the common ones that we tend to have. And then we have the very aggressive one that you may have your PSA values even normal.
What's a
But
PSA value?
it's part of the screening.
Okay.
I mean, it's a screening test.
Okay.
I mean, it's what we call prostate-specific antigen.
Okay.
And that's what the screening is all about.
Okay.
So you may have the value being in a normal range, but if you have a type that we call the neuroendocrine type of the prostate cancer, you may have a normal PSA value. You would think everything is fine, but you have the aggressive disease.
It doesn't sound fun. So, Dr. Saki, I would like you to take this as well. Is there a cure? Is there a cure to prostate cancer?
Yeah, there is.
Okay, tell us about
it. When the disease is picked up early, again, it emphasizes the point on screening. So if the disease is picked up early and it's localized within the prostate, which means the disease hasn't spread, so then we can do something about it. It means that the options you have is surgery, which we call radical prostatectomy. We take the whole of the prostate out, and it's assumed that once the disease is localized or it's within the prostate, if I take out the entire prostate, I would achieve cure.
Okay.
Others have what we call brachytherapy, which we do in Kolebu. We implant radioactive seeds within the prostate, and the radiation is going to destroy the cancer cells still within the prostate.
Okay.
We also have external beam radiation, where we emit radiations to the pelvic region where the prostate is located to burn the cancer cells. So these are things that can offer cure for you.
Okay, so you mean that once it's not localized, you mentioned the word for metastatic. When it spreads.
It's spread.
It means I have no hope.
No, when it's spread, it's gone. So then we move from curative or curative intent to cancer control.
That's like managing it.
Yes. Controlling the disease progression.
Okay.
So that if we start some form of therapy, instead of maybe dying in a year, you can have 3 to 4 years. Or
that's
so.
not good either.
So that's cancer control.
Okay. Dr. Emita, would you say that the cure is effective, or the cures, the way you end up curing the patients, how effective are those?
Yeah, certainly. If you a candidate that qualifies for, the curative procedure, like he mentioned, then it really is effective. But again, the emphasis on what he said is you can only be a candidate for cure if your cancer is picked up early.
Okay.
So if your cancer is actually picked up early and you do go on to have the radical prostatectomy, it's very effective.
Okay. There's nothing like prostate cancer vaccines. Do we have something like that?
Oh yeah, there is.
There
There are
is?
newer, medications that we give.
Interesting.
We call it immunotherapy.
Immunotherapy.
And certainly, it's not something that we readily do in our population. Okay, so but there are newer vaccines that are given to manage cancer.
Okay, so the other cures you mentioned, the surgery and the radiation and all of that, we have all of that available in Ghana?
Oh, the surgeries, it's good we are having this discussion. In Ghana now, we have all forms of treatment, and we do
Great.
them all in Kolebu.
Great.
The brachytherapy I mentioned is done in Kolebu. Just this weekend, we do it. And patients are paying as much as 9,000 euros.
I was going to ask.
Yes, it's quite expensive.
It's expensive.
Yes, and to have the brachytherapy done. So it's something that we readily do. So we would ask everyone who has such a condition, doesn't want the prostate removed, but wants the seeds implanted to come on board, and you would have cure.
Okay.
Yeah.
Dr. Emita, are there side effects to the treatment? Would you say there are?
Yeah, I mean, certainly. So, for instance, if you're having a radical prostatectomy, that is quite a major surgery. So, first of all, just like any other surgery, your recovery is something that we have to look at. And you see, just the fact that the age population of those who tend to have the cancer is such that most of them are elderly. Most elderly people are generally more frail than younger people.
Ones,
so it makes them sort of generally weaker to recovering from the surgery as compared to younger people. And then most of them also tend to have comorbidities. So they may be hypertensive, they may be diabetic, have high cholesterol, have a number of medical conditions that also makes their general management and maybe recovery from the surgery a bit more challenging. But apart from that, so like he mentioned, there's a bit of it that also involves the use of radiation. And so if we're using radiations, sometimes, I mean, as much as possible, the radiation is targeted at the prostate, gland, but in reality, it doesn't, exclusively happen to go there. It's not entirely concentrated there. So you may have some injury to some neighboring organs, and these are like very high intensity radiation. So you may have injuries to neighboring organs, and depending on what organ it is, you may have some symptoms. And then also other general cancer medications that generally cancer cells tend to be fast growing cells. So there are other general cancer medications that are targeted at these cells that will invariably also target other fast growing cells that are not necessarily cancerous. And some of these are some of the cells that are produced in the bone marrow. So you may have some effects like anemia, for instance, also coming up.
Oh, great, thank you. Dr. Saki,
Okay.
Since you're at Kolebu, please give us some of the side effects you have.
Yeah, so the side effects, like he said, it depends on what cure, what I mean, therapy you are offering the patient. If it is with surgery, like I mentioned, the radical prostatectomy, the patients are often concerned about these three things. Erectile dysfunction is very, very important to every man. So that can be one of the side effects, because when we are taking out the prostate, there are nerves that cause that supports erection can easily be interfered with. So we are a bit careful to maintain it. And then the other thing is urinary incontinence, that after the procedure they are not able to handle their sphincters, so they tend to have urine dripping. Again, in experienced hands, these things are very minimal. In fact, in my stay of Kolubu, I haven't witnessed such a marked. Even if it does happen over time, it corrects. And then the third thing is cancer control. You may leave some of the prostate glands, and then when you send to the lab, you would find that the margins are not free of cancer. So which means that the possibility of recurrence can be. So these are the three main ones. And for a man who wants to have surgery, the one important question we ask is, do you want to father a child? If you say yes, we can't offer you, the treatment, because once we do the surgery, it means that you can't father a child. So we take the patient through all these possible, and then they make the best decision they can.
That is rather unfortunate. Dr. Emisa, I learned something new today, that trans fatty acids increase your chances of getting prostate cancer. How true is that?
Yeah. So remember, Dr. Taki talked about the fact that we do not know for certain what the cause is, but there are risk factors.
Yeah.
He mentioned a number of risk factors. Some of the risk factors are what we would categorize as non-modifiable. I mean, there are risk factors you cannot do anything about. So when it comes to something like race, you didn't choose to be black, I didn't either. But this is what we were born with, and that's something you cannot change. Even if you are bleaching your whole skin off, genetically, you are black. So family history, you don't choose what family you are born into, etc. But there are some of the risk factors that are well within our control. Yeah, so he mentioned, for instance, obesity. Another important one is the consumption of diets that are very high in fats, especially animal fats. They've been shown through research that they increase your risk of getting prostate cancer. Yeah.
So we have to be very careful with what we eat. Dr. Taki, you agree?
Yeah, sure. You have to eat healthy.
You have to eat healthy. I didn't know this. I found out today. Okay. Thank you. We'll go for a quick break. We'll be right back. Sure. This is Let's Talk About. We have been discussing prostate cancer. With me are Dr. Emisa, a senior medical officer from the Trust Hospital, and Dr. Taki, urology in training from the Kolebu Teaching Hospital. We've been discussing causes, possible cures, and solutions to prostate cancer. We'll go for a quick break. Please stay. We'll be right back.
This is GKV Foods, a community-based zero-waste agro-processing company focused on the coconut value chain. It came about as a result of the health condition of the owner. So I was diagnosed with diabetes, and a friend introduced me to coconut oil as a food supplement to help stabilize my sugars. So after a couple of months taking the oil, I realized that yes, there was a significant change in my sugars, which caused me to look more into the coconut oil as a food supplement. Our product is basically the coconut oil and then coconut powder, coconut shell charcoal. We are looking into other new products, including coconut snacks. Basically, we use the cold press methodology. So at no point do we add heat or any additive for that matter. So it's just pure coconut oil squeezed out of the coconut meat. We currently can do about 25,000 nuts a day. So 30,000 liters of coconut oil in a month.
family, friends, colleagues, loved ones, young and old. Enuanomne adofo nyinaa, Trinity. It is yet another time for our annual Trinity United Church Yaf Bazaar.
Date: Sunday, 3rd December 2023. Time: right after the joint service till you drop. There'll be lots of food and drinks.
Come and shop for your office wear, church attires, shoes, home appliances, and many more for this Xmas. Wedie, Yamifie, into the Bona Mouth, Falakra.
You can't miss this for any other thing. Please don't forget, this is for charity, and that's the essence of Christmas. Don't be left out on this year's bazaar.
See you there.
Inferior LED lights may tire your eyes over time. Change to Philips LED lights, which give comfort to your eyes. Gentle on your eyes, brighter for your home. Philips LED lights. Innovation and you. Philips.
With the growing challenges of life in light of both global and domestic development, the Christian is faced with the difficult task of balancing survival within a secular system and at the same time living a Christian life that pleases their Maker. It is for this reason that we need to have frank conversations on the many issues of life through the Christian lens. So, we bring to you Let's Talk About. On Let's Talk About, we talk about health, career, dating, marriage, family, divorce, politics, finance, and all the issues of life that the Christian is confronted with on a daily basis. Join us this and every Wednesday on the YouTube and Facebook pages of Trinity United Church Legon, and let's talk about life as Christians.
Hello, welcome back. This is Let's Talk About. We are discussing prostate cancer. Do not forget to follow us and watch us on our YouTube and Facebook channels, Trinity United Church Legon. Send us your questions or comments on our WhatsApp number 0501-579-996, 0501-579-996. Like we introduced ourselves in the first segment, I have Dr. Jeffrey Emisa from the Charles Hospital and Dr. Enoch Taki from the Kolebu Teaching Hospital. Back to the discussion. So we're discussing cures and treatments before going on the break. Now let's stay on that. How useful is exercise to the treatment or control and management of prostate cancer? Dr. Taki, take that from me.
Exercise generally is good for the human body. And so it's not just only for prostate
cancer,
but for our well-being. Okay. So exercise really plays a role. But how significant is it when it comes to treatment? We wouldn't say that doing the exercise would help in any treatment if you have been diagnosed of prostate cancer. If you are diagnosed of prostate cancer, you need to see a doctor. That's what you need to start with. That's a message. Once you are diagnosed of prostate cancer, or you did a PSA screening and it was high, you need to see a doctor. Even if it's not high, at least let a doctor evaluate. Because we don't just use the PSA, but DRE, what we call digital rectal exams. We use our finger to examine your prostate through the rectum. Okay, and that is also a screening tool that we use. So we don't just depend on the go to lab, do your PSA, and that is it. So for every man who is above age 40, it's good to see a urologist for your checkup. So exercise really plays a role in our general well-being. But saying that exercise would help with treatment is not being proven.
Now that you mentioned the DRE, I was going to ask later. People have very scary stories. Dr. Emisa is smiling, so he will take it after you. But people have really scary stories about how uncomfortable or unpleasant it is. How true is that? What will you say to that?
Yeah, it's really not comfortable. But we as professionals try to educate our patient. Before you come, we don't just say lie down. We talk you through. So your expectation also helps to, you know, relax
down.
you. Yeah, exactly. And
Right.
we do that. But presently, if you go to the Western world, people are shying away from DRE, but not in Africa, not in Ghana.
Rather.
We won't support that
Okay.
because in the West, they have very sophisticated equipment
Right.
that can, you know, detect
Right.
lesions in the prostate. But we
Right.
are not there yet.
Okay.
And so we don't support people shying
Shying
away
away.
from it. We have to talk to them, seek their approval, and be gentle.
Okay.
You know, once they are in
Okay.
pain, we need to stop it.
Okay.
So, but it's very important
Okay.
in the diagnosis.
Okay, we'll come back to that.
Yeah.
I have a question. Dr. Emisa will take it for me. Theophilus Nete says, if I get prostate cancer and my prostate is removed, does it make me sterile too? Also, is there a way to prevent prostate cancer, Dr. Emisa? If his prostate is removed, does it make him sterile?
Effectively, yes. By sterility, I imagine he's asking if he still has a potential to father a child.
Okay.
You remember
mentioned
Dr.
that.
Taki
Yeah.
mentioned
Yeah.
that it's
did.
one of the things we try to find out from you before we go ahead with the treatment.
Okay, so yes.
Yeah.
Now he's asking if there's a way to prevent prostate cancer. Prostate cancer. I think we've mentioned some things along the line.
Yeah.
Yeah.
Dietary modifications,
exercise.
and all
Yeah.
of that. Okay, so Theophilus, we hope we've answered your question. Now, Dr. Taki, what role do you think traditional and spiritual leaders have to play in the treatment or cure of prostate cancer? Because you're walking around and you hear this, you know, medicines, drug sellers saying they can cure prostate cancer. Is that true? Have you tested traditional medicine?
Well, I mean, this question is a bit political, but I mean, what we do is we are in a country where the Food and Drugs Board, I mean, we accept herbal, you know,
Yeah.
preparation. But I won't say that people should jump at any medication that is sold to them as curing prostate cancer. When you have prostate cancer, we are treating evidence based on evidence. So you have to come to the hospital. What shows that you have prostate cancer? Okay. We do what we call tissue biopsy.
Okay.
We take a piece of your prostate and send to the lab. And then the pathologist will say that, okay, you have prostate cancer. So if you haven't done all this, how then do you take a medication?
Yeah, what are you treating?
Exactly, so we should know what we are treating. Okay. So but I would say that come to the hospital, get the proof that you have prostate cancer, and then seek treatment.
Okay.
Yeah, but buying medicine from the roadside is not helpful.
advisable.
It's not advisable.
Right. Dr. Misa, you want to say something?
Yeah, I just wanted to add that if you have ever sat in an audience that was privileged enough to, you know, listen to some of these traditional guys market their drugs, you would notice they would first of all advertise the drug as curing prostate. First of all, the prostate is not a sickness itself. The prostate is very much a part of our body, just like the hand is. It is the medical condition that affects the prostate that we are concerned about. And like Dr. Taki mentioned, prostate cancer is not the only condition that can affect the prostate.
Yeah.
You can have a prostatitis, which is like inflammation of the prostate. You can have the prostate gland itself enlarging, and it's non-cancerous, something we call a BPH, or a benign prostatic hyperplasia. And then you can have, you know, the prostate cancer itself. So if you are advertising a drug that is like an all-in-one, especially for most of those drugs that have not had extensive clinical trials that shows enough objective data to back, you know, in the evidence of they treating, you know, prostate cancer and whatever side effects that it even comes with. I think you'd be throwing yourself in the deep if you're just subscribing to,
stuff,
you know,
like that.
Yeah.
Okay, thank you. So we have another question from Daniel. Daniel says, if I store too much urine in my bladder for a long time and I start feeling pains when passing out the urine, would that cause prostate cancer? So retaining urine for a long time, would that cause prostate cancer? And he says, how can such a pain be avoided?
Okay,
Dr.
so
Taki.
storing urine for a very long time is not a cause
thing.
of prostate cancer. Rather, what it does is it causes infection. Because you have stasis or urine is not flowing when it's supposed to flow, you are intentionally keeping it. It will be a milieu or an environment for bacteria to thrive. Again, urine is salty. And so if you have urine collecting for a long time, it's like you have seawater. Over time, they crystallize and they form stones.
Yeah.
So you end up having bladder stones, stones in your bladder.
Okay.
Again, if you have urine stored in your bladder, remember that the kidneys are producing more urine.
Okay.
So over time, the pressure in the bladder will be built up and there will be backflow of urine to your kidney. And that would cause kidney renal impairment. And you end up being on dialysis for something like that. So anytime you feel the urge to urinate, you need to pass urine.
Okay, thank you. Thank you so much. Dr. Amisa, let's talk about stigma. Do you have cases, or have you seen cases where people or cancer victims or patients are actually stigmatized for having cancer, particularly prostate cancer?
Yeah, I mean, stigma is very much a problem with a lot of medical conditions, some more than others. And then cancers in general as well, simply because, especially for anyone who's had a cancer and has had to undergo some form of surgery, traditionally we have this belief that the human body must be whole.
Yeah.
So if for whatever reason you've had a part of your body removed, then it makes you unwholesome, and you are probably not fit to be counted, amongst the normal people. So that is one possible source of stigma. But apart from that as well, there are some people that also overutilize the information we give. So for instance, just like Dr. Taki mentioned, usually cancers may tend to run on genetic lines. So there's a hereditary component. It doesn't necessarily mean that if there's someone in your family who has a cancer, the lineage is all going to go on and show cancer, but it just means that relatively the propensity of another cancer resurfacing in that family compared to another family that has absolutely no history like that, the former scenario is higher. So you can also have a situation where people may shy away from marrying or intimately engaging such families because they've tagged them as this, as a family that has cancer. So I think these are some of the stigma areas I can think
touch
of.
on. Yeah. That's fine. Dr. Taki, have you had instances where people have tried to avoid treatment for the fear of exposing themselves as, patients, prostate cancer patients?
Exactly. There are times that people don't want to because they are men. Sometimes people want to feel like, I'm a man, I'm a man. So they keep their symptoms, especially when they have blood in their urine. And I keep telling patients that, or people, that anytime you find blood or you see frank blood in your urine, report to the hospital, even if it's just an episode. Okay, so there are times that they don't report to the hospital very early. And that leads us to the stage where the disease is no longer localized, but it's spread. And then the management becomes catastrophic and very expensive. Because then if you have the spread type, it's gone to your spine and all that, we need to be giving you hormonal treatment, injection. And every 3 months you have to buy an injection that is costing about 4,000 every 3 months. And for those who don't have the money, there's another option where we do what we call bilateral total orchidectomy. We castrate or we take the testes out. So those are the stage, and it becomes very, very uncomfortable and very depressing for the patient. And so we don't want you to get there. So let's start the screening process. Report symptoms very early than coming late.
Why do all the treatments sound so drastic?
Yeah, because it's very expensive. it is very, very expensive. And it gets to a point that even the 4,000 injections you get, the cancer becomes resistant
to the injection.
To the injection, and then we have to add on another tablet that is costing about 9,000 a month.
Interesting.
So it's
not good.
It's not a good thing.
Yeah, so I think I just want to add that as a follow-up to the question you asked, if you're diagnosed with prostate cancer and you are refusing treatment, then your scenario is very similar to someone who is not having an early screening, because the whole basis of the screening is effecting an intervention.
Right.
So if you have on one hand someone who is not screening at all, and so does not even know the cancer exists, and on the other hand someone who has screened and found out that there is cancer but doesn't want an intervention, then your chances are, your survival chances are similar.
Okay.
And you notice from what he's saying is saying that any further delay, either with the detection or the initiation of the appropriate treatment, leads to more complicated management modalities.
Okay.
And ironically, those complicated management modalities even have poorer outcomes or poorer prognosis. They are more costly, so there are no wins on that side. Yeah. So early screening,
right.
But if unfortunately, you are told that there is prostate cancer, you will, of course, there will be counseling and all of that to let you know what the options are. But the sooner you subscribe to whatever appropriate management it is, the better for all of us.
Right. Thank you so much. Dr. Taki, let's talk about awareness. So, for even women and men, we know that in October is Breast Cancer Month, Pink October, Even if you are not willing, there will be so many screening opportunities for you to go to. What about prostate cancer? Is there enough awareness?
Well, so, wherever women are, the attention is always there. But for years now, we've been doing, September is the prostate cancer month for us in Ghana. So right after the September month of prostate awareness is the
breast cancer.
Yes, exactly. And what we do is we flood the radio stations, TV stations, churches, groups, and talk to them about prostate cancer. And then we also advise them to do the early screening. And so the awareness is there, but like I said, it's taking grounds and it's Ghana, the nationwide awareness. So we have the urologists who are in the northern region who also spread the awareness message.
Okay, so we have a question. Festa says, can prostate cancer be classified as a hereditary disease? We have sort of established that, have we? So it can be.
It can be.
You can tread on those lines as well as like a lifestyle
genetic,
disease.
Actually.
Okay, that is fine. So let's talk about people who have been diagnosed with prostate cancer and are probably undergoing treatment or not. And for those of them who are married, how does it affect their everyday life, their sex lives, everything? How does it affect that? I'll let Dr. Misa take it, then he'll hand over to Dr. Taki.
Okay, maybe I'll just talk about a little bit of it.
Okay.
So first of all, the diagnosis of cancer is always quite a heavy one, psychologically, emotionally. Yeah, so that alone put a stress on marriage or whatever intimate relationship there is. And WHO defines health as not merely the absence of disease, but also being in a state of complete physical, social, and emotional, well-being. So once you have one of these major areas impacted, it will show in your general, health status. So first of all, that is one that is affected. And then also, definitely your sex life will be affected as well, because, so like Dr. Taki mentioned, there are some of the injections and medications that are used to treat prostate cancer, what they do is they lower the male sex hormones, the levels of the male sex hormones, because when the levels of these sex hormones are high, they tend to encourage the growth of the cancer cells. So conversely, you'd want to restrict the levels of these male sex hormones, and that will generally lead to decreased erection and a general loss of libido or low sex drive, and that is another thing that greatly impacts families or couples who have a diagnosis of prostate cancer.
Okay.
That aside, you can also talk about the cost implications, like he said, especially if it is not one that is picked up early. The cost implications can be quite grave. And then if you happen to develop any of the complications we've spoken about that may be associated with the treatment, then there is even more, there's more to contend with. And then you may find yourself having to go to the hospital every now and then, and that will affect the quality of life and general satisfaction as well.
Right. Okay. You said you were going to say just a little, but I think you've exhausted my question. So it's fine. Dr. Taki, I'll have you take something else.
Okay, sure.
So for breast cancer, I can't speak to the others. We, for detection and all of that, we have self-examinations. We are taking through some tutorials. Do we have that for prostate cancer?
Well, for prostate cancer, no, because of where the prostate is not external as the breast is. And so we ask for the screening, and then you also visit the urologist.
Okay.
And so if you are 42 and your father died of prostate cancer, you need to see a urologist.
Okay.
And like I said, you will do the screening and the DRE.
Okay.
But sometimes the screening would show as normal, because on the report you would see 0 to 4.
Okay.
And you would maybe score 2.5. So you think everything is fine. But when you come, we will do the DRE, and then sometimes we find nodules. So you realize that just scoring 2.5, being in the normal, does not necessarily mean that. See a urologist.
We have already talked about the possibility of a recurrence.
Yes.
You said there's the possibility.
Yes, if the margins are not cleared during the surgery.
Okay, so now let's speak to how our families and our partners and people around us can help us. For those who are diagnosed with prostate cancer, those who are probably treated and are fully cured, how can we help them as their family members, as friends and loved ones? Dr. Emisa, would you like to say something?
Yeah. On a lighter note, there are a lot of us men. I mean, before you get us to the hospital, you probably have to put a gun to our head.
Yeah.
Yeah, generally, males tend to have relatively poorer health-seeking behavior as compared to females. Yeah, so the females, so someone like yourself, would be very grateful for the support and the push to seek, early, health assessment. So again, we come back to the screening.
Okay.
Very, very important. So if we can place as much emphasis on prostate health and men's health as much as we do for women. I mean, practically it will be difficult. I personally say, for as long as we always make more noise about Mother's Day than Father's Day, we might probably never get there. But we can at least close the gap a bit. Yeah. So a lot of health education, to not necessarily waiting for a formal platform like what we're on, but you have partners, you have brothers, you have other male people in your life. Informally, you can just tell them a thing or two you've learned, and then you have this bell ringing in their minds, and then they might want to, go check themselves out. So that is for generally people who've not been diagnosed with any prostate disease or prostate cancer, for that matter of fact. For those who have more so, they would even need more support. So we will have to go the extra mile in terms of offering emotional support, if you're in a position to offer financial support and all of that, because it's never easy dealing with any kind of cancer. So.
Thank you. Dr. Taki, if he has not said everything, please add something to that. How do we support the cancer patients?
The other bit is the financial support. That's one key thing. Because realize that, it becomes very draining for the family. And it gets to a point where you can easily tell that the man doesn't want his testes removed. But the children are saying, go ahead. And then we say, well, we will not listen to the children as a man. Sometimes they have to get to that point of making a decision that they really were not really into. But for the sake of the family and financial, then before long they become depressed, which is quite a troubling situation. So financial support is also major.
Plus the emotional.
Yes. Okay. And let me add one other one, especially from our female partners. So you would realize from what we've said that some of the treatment modalities may make the patient have it very difficult achieving an erection. What that means is consequently sexual satisfaction in the home will be affected. So the women have to come through for us, and in that regard you have to offer support to your husband. And men naturally are a bit egotistic, and especially when it comes to having the satisfaction of being able to please a woman, but you should be able to talk to your partner, let him know that you understand and that his life is more important than sexual satisfaction. Rather, we have a few instances where some women even threaten their husbands that, if you are going to go for any intervention that is going to render you impotent, as for me, I'll find my somewhere and go. That is as much of an emotional, it offers as much emotional damage as it is to affecting, their sanity in terms of making the correct choices for whatever treatment options are available.
Okay, so they are affected. Dr. Taki, you agree?
Yeah, that's it.
Okay, I don't think this was pleasant. Talking about it wasn't pleasant, but final words, anything?
Okay, so again, we would spread the campaign, the news. The take-home message is that anytime you find something unusual, be it blood in your urine, report to the hospital. Desist from buying any medication, so to you, see a urologist. And then also for those of us who are, for men who are 40 years and above, who come from homes where there's strong family history, see a urologist for a start of the screening process. Yeah.
Thank you. Dr. Emisa, final words, please.
I think Dr. Taki has said it. The emphasis, we cannot emphasize it enough, the point about screening. Yeah. We're talking about screening simply because you can have prostate cancer for quite a significant amount of time and not even know. And the only way you can pick it up is by subscribing to some form of screening. And like we also established, unfortunately, because of where the prostate is located, you cannot do a self-exam, even if you're a doctor. No matter how skilled you are, you cannot comfortably do that in any effective manner. So let's just increase the sensitization and have a generally low threshold to seeking health assessment.
Thank you. Thank you, viewers, for staying tuned. We have been discussing prostate cancer, and I've been talking to Dr. Jeffrey Emisa and Dr. Enoch Taki. We have learned a lot from how to make dietary modifications. We have learned today that it can be hereditary and it can be a lifestyle disease as well. We have been advised to seek early screening and early detection. And when we are unfortunately diagnosed, we are to be open to discuss treatment and accept it wholeheartedly. And for those of us around them, family members, partners, friends, loved ones, we are to support them as much as we can financially most importantly, and then emotionally. We are to be shoulders they can lean on. This has been Let's Talk About. We'll see you same time next week. My name is Sedi Nam Togo. Lamadeku, good night.
This is GKV Foods, a community-based zero-waste agro-processing company focused on the coconut value chain. It came about as a result of the health condition of the owner. So I was diagnosed with diabetes, and a friend introduced me to coconut oil as a food supplement to help stabilize my sugars. So after a couple of months taking the oil, I realized that yes, there was a significant change in my sugars, which caused me to look more into the coconut oil as a food supplement. Our product is basically the coconut oil and then coconut powder, coconut shell charcoal. We are looking into other new products, including coconut snacks. Basically, we use the cold press methodology. So at no point do we add heat or any additive for that matter. So it's just pure coconut oil squeezed out of the coconut meat. We currently can do about 25,000 nuts a day. So 30,000 liters of coconut oil in a month.
Inferior LED lights may tire your eyes over time. Change to Philips LED lights, which give comfort to your eyes. Gentle on your eyes, brighter for your home. Philips LED lights. Innovation and you. Philips.
Tertiary education has become imperative in this new time and age. The rapid need for tertiary education has brought about numerous tertiary schools. The one thing remains true and sure, and is the fact that everyone in pursuit for tertiary education is looking for thunders and maximum output. We have a serene atmosphere and qualified lecturers, modern state-of-the-art facilities to enhance learning. NASFA University is located at East Legon, behind Mensvik Hotel. We are affiliated to the University of Ghana and the University for Development Studies. We offer BSc Business Administration with specialization in accounting, finance, human resource management, and marketing. BSc Nursing, BSc Media and Communication, BSc Economics, BSc Computer Science, and BSc Information Technology. Our MBA programs are MBA Accounting, MBA Finance, MBA Human Resource Management, and MBA Marketing. NASFA University, the Royal University of Africa.
With the growing challenges of life in light of both global and domestic development, the Christian is faced with the difficult task of balancing survival within a secular system and at the same time living a Christian life that pleases their Maker. It is for this reason that we need to have frank conversations on the many issues of life through the Christian lens. So, we bring to you Let's Talk About. On Let's Talk About, we talk about health, career, dating, marriage, family, divorce, politics, finance, and all the issues of life that the Christian is confronted with on a daily basis. Join us this and every Wednesday on the YouTube and Facebook pages of Trinity United Church Legon, and let's talk about life as Christians. With the growing challenges of life in light of both global and domestic development,